and welcome to this edition of Pet Pals TV with Tom Dock, certified veterinary journalist, also Pet Pals TV investigative reporter, and Noah's Animal Hospitals. So, you're a busy man.
I am a busy man, but always happy to be here.
Okay, and Stewie likes him too, so that's all I need to know. We're talking about pet cancer. 1 in 4 pets will experience some form of cancer in their lifetime, and there are some breeds, like boxers, golden retrievers, and Bernese mountain dogs, that it tends to be more prevalent than. Let's talk.
Yeah, it really does. And you and I both have experienced this with previous pets, and so it's a scary word to people. But I think what we've got to understand is, just like in human medicine, things have progressed and we now have options. And so there are solutions. There's radiation therapy, there's surgery, there's chemotherapy, immunotherapy, even nutritional type therapy that can help either extend the pet's life or even get them into remission and be curative.
Okay, very good. I always say that grooming helps because the groomer can then feel, oh, there's a lump here or a lump there. So that can give you a little inkling that something might be going on. But a lump or a bump doesn't always mean cancer.
Right, a lump or a bump could be something, just an overgrowth of cells, which most people equate with cancer,
right.
But it's not always. It could be benign. Lots of our breeds get fatty tumors, lipomas, that are a big accumulation of fat cells, but it's benign. We can often take those off. And so just like you said, if your groomer says something, if you're playing with your pet and you're rubbing on them and you notice something, a change in skin color, bleeding from the nose or the mouth, that's the time when you got to call the veterinarian and say, hey, let's talk about this. Don't fret, don't get scared, but let's get the information.
And even the vet, even the great vets that you have, would not be able to tell until they got to go in and take a look at it inside. You know, what is it called? Cytology?
Cytology, right, yeah.
Cytology.
So we get that a lot. You know, our fingers and our eyes aren't microscopes, and we're looking at tiny, tiny cells. So we stick a needle in, we pull back and get some of those cells into the needle, we squirt them out onto a slide, and then a veterinary pathologist can stain it and look at it, and that's an expert who is going to be able to tell you what kind of cells they are, whether or not this is benign, whether it's malignant, and what's our next course of action.
Okay, very good. Well, these are the things to look for: sudden weight changes, difficulty eating, difficulty breathing, abdominal swelling, bleeding from the mouth or the nose. These are some telltale signs you better go to the vet right away.
Don't panic, because those could be signs of other things, but it is a sign that we need to get to the veterinarian. And then, when we do all that, your veterinarian may talk about, we're going to send this lump off for pathology. Let's determine what that is. We can't tell that, only a pathologist can tell that.
And I know that you went through this too. My Louie, my first Bernese mountain dog, had cancer, and within 6 weeks, he was gone.
Yeah, Loki.
It worked, I mean, it was amazingly fast, which I still can't talk about it.
Yeah.
Yes, go to your vet. I, of course, recommend Noah's Animal Hospitals. And thank you so much for all that you do.
Always a pleasure.
Okay,
Thank you.
so we get up and say goodbye. Oh, yes. Oh, there you go. We'll be back with more on Pet Pals TV.